Hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. My name is Dr. Arinola Dada, and I've been a rheumatologist for the last 20 years. Today, we are going to talk about what's been bugging me recently, which is smoking and rheumatoid arthritis. So the other day, I had one of my very dear patients. I love her. She loves me, but we have this thing that she does called smoking. So the other day, I was talking to her about her rheumatoid arthritis, and I was like, "Girl, are you still smoking?" And she's like, "Yes." And I was trying to talk to her about what medications she should use because I was having a difficult time controlling her rheumatoid arthritis. And I was like, "Well, should we add this medicine?" And she's like, "Well, what about the side effects?" I was like, "You're smoking." She's like, "Yes, I know I'm smoking, but I don't want to add anything else." That made me think, you know what, maybe I need to tell people a little bit more about why smoking is bad, but why smoking is even worse still if you are at an increased risk for rheumatoid arthritis. So what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease, and that means that the immune system is overzealous. What does that mean? It's overzealous and it actually turns around and goes a little cuckoo. What is your immune system anyway? What does it do? Well, your immune system is basically your soldiers. It's your military. And what it does is that it fights over invaders. So those invaders could be invaders from outside, both foreign and domestic invaders. So foreign invaders would be like viruses and bacteria and infectious processes trying to invade your body from outside. Your immune system is supposed to protect you from that. Internal invaders are things like cancers. So your immune system is really protecting you both inside and outside. But for patients with rheumatoid arthritis, sometimes the immune system goes a little cuckoo. And in this case, the immune system starts to attack joints and cartilage. The good news is that we've been able over the last few decades to actually be able to treat rheumatoid arthritis. But there are certain things that you could be doing that could make it more difficult to get your rheumatoid arthritis treatment, or even worse still, increase your likelihood for developing rheumatoid arthritis in the first place. So a lot of people think about smoking as being bad for their lungs. That is true. It is certainly bad for your lungs, increases the risk for chronic obstructive lung disease, also increases the risk for cancer. But that's not what we're talking about today. Today, we're talking more about the fact that rheumatoid arthritis can be a result of your smoking. And how? Because smoking causes abnormal proteins, and those proteins cause cytokines, and those cytokines are responsible for the storm that you have when that causes damage in patients with rheumatoid arthritis. But there's another piece, and that is that people do know that rheumatoid arthritis can run in families. And a lot of times when I have a patient in the office, they tend to ask if they've been diagnosed as rheumatoid arthritis. They want to know if their child may be at an increased risk. It is certainly possible that their child is, because it does tend to run in families, but the inheritance is not like a Mendelian type inheritance, like the color of the eyes, that kind of thing, or the color of your hair. So there tends to be a genetic predisposition if you have a family history. Now, there has been an identification of a certain gene variant, and it's called an HLA-DRB1. Now, this may not be easily accessible for you to get it tested, but if you have a family history, you might as well suspect that you probably have something like that. So this gene is also known as kind of a shared epitope. That's another word that we use for it in rheumatology, which means that you have this gene that increases your risk for rheumatoid arthritis. So this is where it starts to get unfortunate, is that if one has this gene, and one is smoking, one can increase one's risk of rheumatoid arthritis by 7 to 10 times the risk compared to like if you had like someone else who had the same gene, but that is not smoking. So your smoking does increase your risk arthritis by 7 to up to 10 times because it turns on all the inflammation. So the person already is kind of carrying that gene, and then smoking just pulls the trigger. So you have a loaded gun, but once you start smoking, you're pulling the trigger. So people ask, what are the things that cause rheumatoid arthritis? Oh, what can I do? If you smoke, stop. because you can actually reverse this. If you don't smoke, don't start. If you have a family history and you don't know whether or not you have the gene, still don't start smoking because, it causes a lot of things, including bladder cancer that we didn't talk about. So just wanted to kind of lay it out there as to the fact that having a gene that predisposes one, as well as having the smoking as a habit, definitely increases one's risk of rheumatoid arthritis. And they've found so many reasons why. In addition to the gene, it causes inflammation, it alters a protein, so it develops an antibody, and it makes it even more difficult to treat, which is where at the beginning of the story I told you, hey, this is something that I'm experiencing with a patient that has rheumatoid arthritis, and she smokes, and she's a lovely woman, but we need to get her to quit smoking so that we can actually successfully treat her rheumatoid arthritis so she doesn't end up with deformed joints and a terrible quality of life. So good news is, if you stop smoking, even if you've had rheumatoid arthritis already, there is something that can be done. Medications will be more effective if you are able to stop smoking. So this is such important information. I would love for you to share this with anyone that you know or love that's dealing with rheumatoid arthritis or maybe at risk for rheumatoid arthritis. Like our videos, subscribe to the channel, and I'll be sure to bring you more important tidbits next time. You take good care. Bye-bye.